Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hey there, Dr. Moya. How are you today?
Hey there, Brittany. I'm doing great.
Wonderful. So today I wanted to ask you what your approach is for the upper arm area. What do you do for that extremity?
That's a great topic. Very common in my practice, probably second or third most common thing that patients ask for when it comes to skin removal and contouring. When it comes to the upper arm and weight loss, I find that most of the loose skin, when it comes to the arm in general, is in the upper arm. And a lot of patients can have a skin that may even extend, the loose skin can extend onto the elbow, partially onto the forearm. Definitely affects the underarm. The underarm becomes loose and it kind of falls away from the shoulder. Mm-hmm. And then even can extend on the lateral chest. So for me, that's a whole arm area when it comes to evaluating the patient to decide what's best. Most patients that lose a significant amount of weight are going to require what I call a major arm lift. There's different types of arm lifts. Basically, if you were to research it, you would see that there's a mini arm lift, a limited arm lift, a standard arm lift. I call what I'm going to talk about a major arm lift. There's even an extended arm lift. There's a whole bunch of different terminology out there. Mm-hmm. I'm going to just talk about, in particular, a major arm lift because that's what I do about 98% of the time, I would say, 99% of the time for patients who lose a lot of weight. So a major arm lift for me means that I need to address the upper arm loose skin and make it fit in to the elbow, the underarm, and the lateral chest. So you got to make it fit in. It's not just about taking away a big bat wing, for instance. You know, you have a big area of skin that's hanging off the upper arm, looks like a bat wing.
Or a bingo arms.
Or a bingo arm, exactly. We hear that many times from all our different patients. And you just can't go in there and just cut it out. Because if you do that, next thing you know, it doesn't look like it fits in at all. It's all about, like as we've talked before, it's about making it fit in to the rest of the body so it looks like you never had it before. Mm-hmm. So when we start talking a major arm lift, that means I need to address the upper arm, the underarm. A lot of times we go onto the lateral chest. When it comes to the elbow region, I used to go onto the forearm, but I found that there's a lot of nerves there that if you go onto the forearm, you can knock off one of those nerves and you have a big patch of numbness on the forearm. Okay. So if patients ask, why don't you always go on the forearm? That's the main reason. And then the other thing is if you're not going to go all the way from the elbow to the wrist. So How do you make it fit in? Loose skin usually extends throughout the entire forearm. So if we can avoid the forearm and make it tapered into the elbow or make it fit into the elbow, it looks very natural. Mm-hmm. So for me, my end point is the elbow.
Okay.
And a lot of times today I go onto the back of the elbow, but to go back, when we start talking major arm lift, we start talking about an incision that extends from the elbow, the upper arm, the underarm, and onto the lateral chest. Mm-hmm. So that's the extent of the incision. How we place that incision depends on what the patient looks like when they're coming in. Basically, you can have an incision when it comes to the upper arm along the inside of the upper arm. So it's like the middle of the upper arm. It's really the division between the bicep muscle and the tricep muscle. We call that a medial arm lift. And then you can have an incision along the bottom of the upper arm, not on the back, but the bottom. I call it the inseam approach. So it's like we're in the inseam of a shirt. Mm-hmm. And then you can have an incision along the back of the arm. And that's called, back of the arm approach. And why do we have so many? Because everybody's different. So we want to make sure that we're picking the right incision to get the right result.
Right.
Today, and I do all of them. Today I've really migrated to the inseam approach because it it gives me the best of both worlds. Basically, an inner arm approach allows me to remove a lot of the loose skin that's maybe really stretched in the inside of the arm. You want to get rid of the loose skin that's causing most of the problem.
Mm-hmm.
But it's more visible. You lift your arm up, it's right there. You can see it. The back of the arm is a great approach because you can taper it really well into the elbow and along the underarm because you can get rid of that big dip, that big bingo wing dip of skin. The downside to that is very visible. You're walking and you're swinging your arms back and forth. Somebody will say, oh, look at that big, you can see the big scar on the back of the arm.
Mm-hmm.
So, and then sometimes that scar can widen a little bit. So an inseam approach being in the middle of those two, it's the best of both worlds. And if you tweak it, which we do, we tweak everything, it really looks great. And I'm very, very, very happy with that. So today I've done all of those approaches, but today I've really migrated to an inseam approach. And so for me, when I do upper arm lifts, that's the approach that I'll use. I don't do any marking before surgery. And this has evolved over time. I used to mark. And so if patients look it up, they're going to see a lot of marking before surgery. I find it doesn't help me. And I've gotten away from marking usually in any procedure today, but arm was my last one actually. I was still marking up to maybe a year ago even, because I keep tweaking it and keep changing my approach, and I think that's what keeps you going and keeps you really doing what's best for patients. You got to continue to make it better.
Right.
So we're always being really critical of our results. So I stopped marking about a year ago when I started doing more of this inseam approach. So for me, what I normally do when I do an arm lift, once I determine that that's the best approach, we're going to do this, we're going to do that. When we start doing the procedure, the first thing I do is I actually liposuction the arm.
Okay.
And that might lead into, does everybody need liposuction? The answer is technically they may not have fat there to remove, meaning a whole bunch of fat there. They may not look that full, but they're all going to get liposuction. Because part of the reason why I do it is it allows me to remove the skin easier. It allows me to stay in a safer plane, kind of like the other reason why when we talk about thigh contouring and liposuction. Right. So every single patient will get liposuction regardless if they're full or not.
Okay.
A lot of our patients are partially deflated. They're not fully deflated yet because the arms can sometimes get stuck. And so the liposuction will help us because it'll deflate the arm more anyway and then allow us to remove more skin.
Okay.
So every single patient that I do will get liposuction for one reason or another. It's either definitely to put us in a better plane or number two, to deflate the arm. There's a third reason I'll do liposuction if it's outside my area of skin removal. So meaning, let's say the upper bicep area where the shoulder groove is. If there's a collection of fat there that I can pinch and feel, then I'm going to liposuction that because that's going to add to the arm contouring. And we don't charge any more for that. That's kind of built in. We do whatever gives us the best result. So everybody's going to get liposuction when it comes to arm contouring. Once that's done, then I actually mark the arm. It's kind of how I do it. And I kind of eyeball. Today I can eyeball everything. And I feel like I do a great job at it.
I think so too.
well, thank you. But I eyeball where I want my scar to end up. And then we do tailor tacking. And tailor tacking, again, we've talked about that before. Basically, you're pinching the skin together to determine how much you can remove and where you're going to end up with the scar. And then we go ahead, once we do that, we go ahead and remove the skin. And again, it'll go from the elbow to the lateral chest. And then we go ahead and close everything. So if anybody would know how we do an arm lift, that's kind of how we do it. And of course, we tweak everything to fit the natural shape of the arm for patients.
Right.
Sounds like that's pretty straightforward and easy. It still takes me 3 hours.
Yes.
Or sometimes 4.
Oh,
because some patients, yes, if there are patients that have a more of a non-deflated arm and I have to do more liposuction, it's going to take me up to the 4-hour mark. So, and of course I'm very picky and we want to even out both sides, make sure the scars are equal, both sides are equal. Once we're done with that, it's an immediate change. I mean, it's like, when am I going to see my result on my arm? It's immediate. It doesn't matter.
Right away.
Doesn't matter how many dressings I put on. And we do ace wraps right after with a little bit of dressings on the incisions. The incisions are closed under the skin. We use glue on top of the skin so it seals everything. And then I put some nice tape, the color of the skin, so it kind of hides the incision. But every single patient in the recovery room, I'm always excited to show them. I'm like, take a look at, once they're awake enough, of course. I'm like, or their spouse or their significant other, whoever's there taking care of them. I'm like, take a look at this arm. And I lift the arm up, and you can clearly see how much smaller it is.
That's great.
So it's always exciting because, that's why the patient came to see us, right? So on average, with that kind of procedure, you can remove 4 to 7 inches or 8 inches of skin.
Oh, wow.
And that's top to bottom.
Right. That's quite a bit.
It's a big, right. And then you liposuction some of that away. It's a big difference on the arm.
Right.
So I think when it comes to arm contouring, it's a very satisfying procedure. Obviously for me too, but for making the patient very happy. After surgery, I have them wearing ACE wraps, usually about 48 hours. Then they can take everything off. They can shower. Of course, I don't use any drains like everywhere else.
Right.
Again, part of that is the fact that when I remove the skin, I do use ultrasonic technology, the harmonic instruments, which we've talked about in a separate podcast. Everything is tailor-tacked. So again, you're minimizing undermining. And that works very well for no drains. So after surgery, we ask patients to use the ACE wraps for at least 2 days. And then it's up to them whether they want to continue compression or not. If we didn't do a lot of liposuction outside the skin removal zone.
Right.
Meaning if we did liposuction along that shoulder groove, the bicep muscle, the back of the arm, then they have to use compression for at least 3 weeks. But if we do liposuction only in the area that we're removing skin, then they can stop compression after 2 days. A lot of patients might be comfortable with some kind of compression, and we can give them a sleeve. And a sleeve is a nice compression garment that just makes everything feel tight.
Right.
But we leave that up to patients.
Right.
And then, of course, the activities are limited for 4 to 6 weeks. And usually for the first 3 weeks, I limit patients extending their arm up above their head. So basically, I might limit to it's about 90 degrees, parallel with the floor. Otherwise, we keep it to that degree so they're not pulling on the incision under the arm. Because that's the area that's the tightest. And that's the area that I think most patients, if you say, well, what kind of pain do you have with an arm lift? I would say that it's 1 out of 10, about a 4.
I was going to say like a 3, usually 3, 4.
Yes, and you see them all the time post-op. So yes, it's on the lower end. We're not dealing with muscle, so we're not tightening anything there. The part that probably hurts the most is just under the underarm because it's a little sensitive. You can be rubbing it when you're moving your arm up and down. Definitely, it's tight after surgery, so that's the area that can hurt. And then after 3 weeks, then I start having them stretch their arm up because now the scar gets a little tighter in that area. A lot of times patients say, well, it feels like my skin is being pulled away a little bit.
Like a little webbed in a way.
Correct. It looks like a web under the arm, right? And it probably is a web at that point of healing. But every single patient, when you start getting to 6 weeks, 3 months, the skin around that becomes softer, the scar becomes softer, and it falls right back to your body. There's no web at the end of the day. And I've never had to touch up an underarm incision because when you're doing a major arm lift, it's obviously a weight loss patient whose skin has stretched. So the skin will settle. The remaining skin will settle, and you won't end up with some kind of like scar contracture or a really tight scar. So
with the incision placement into the armpit and down a little further, what happens to all the armpit hair in that area?
That's a good question. Today it's depending on the approach. If you do, the higher the incision becomes, the more we pretty much get rid of all that skin.
That's awesome.
So for instance, then if you say an inseam approach, usually I get rid of about half of the hair-bearing skin today. So you'll have a little bit left, but nowhere near what you had to deal with. So it's a nice benefit of surgery. Yes.
Added bonus there.
Absolutely, absolutely.
What about any little complications, openings and along the arm?
Again, a great question. I would say that the complications are at a minimum with an arm lift. The most common thing that we'll see would be maybe a spinning stitch or a small opening in the underarm. Again, because it's a tight area. And you can have a little bit of fat necrosis that can occur there as well. Fat necrosis being fat under the skin that liquefies, usually 2 to 3 weeks after surgery, and all of a sudden gets a little red around the incision. Next thing you know, you get a little pop and some greasy liquid comes out. And then we have to do a little bit of wound care for that, meaning it could be dry dressing or It could be some antibiotic ointment, or even may need a little bit of wicking, a little bit of packing in there. And that heals very, very well. I don't even know the last time I really had to do a scar revision. I can't even recall in the last several years. I mean, it heals so well that there's no, and we're picky. So if patients didn't like a scar, we would definitely revise it, but we don't really see that.
Right.
So I would say that the success of the procedure is very, very high. If patients are concerned about the scar, I would tell you that I think the scar over time, the way that we close it, we use these nice barb sutures. It really gives a nice tight closure. They fade very, very well. And for most patients, it stays very, very thin. Mm-hmm. So we don't do scar revisions even from the perspective of, let's say, a real wide scar or depressed scar.
Right. And I think for most patients, it's a nice trade-off for the bat wings.
Absolutely. I mean, 100%. I mean, I think we discussed that before, in planning, are you opposed to the scar? If you are, then that's not the procedure for you. But I think patients who come to us seeking an arm, skin removal from the arm contouring, they don't care about that scar. They want to have nice shape. Right. And today I've been very happy with the inseam. It's a really good scar that's sometimes really hard to see in different views because it's right at the bottom of the arm.
Right.
Again, I'm very happy with that, and patients are very happy with it as well.
And remind us what you can combine this procedure with if they want to combine other areas.
Great question. A lot of times we combine arm contouring with breast contouring, and then we call that an upper body lift. And we have a whole podcast dedicated to that. Very, very common way to split up the body. Most patients have more than one area of concern. A lot of times when we put together a plan, if we start talking arms and if a patient does have a concern with their breasts, that's a nice combination right there. And that's the most common combination would be arm with breast. Right,
but you can do it if they choose not to do their breast. They can combine it with a waistline contouring if they wanted.
Absolutely, combining meaning if it's anything less than a corslet body lift, you could probably have it done the same day. If it's a corslet body lift or a lower body lift that takes all day long, then it would have to be done as a second day procedure, what we call a back-to-back surgery.
Right.
But it can be done for a one-time recovery.
That's great. Okay, well, that's all I have for the arm area. Thank you so much.
All right, well, thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corslet Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.